Hi, this is Dr. Larson with Euphora Health. I just wanted to take a few minutes to talk with you about how we address diabetes. And really just talk about in general, this is a good example of how we would address any chronic disease for one of our patients with any one of our doctors here at Euphora Health. So this is a slide that talks about a real patient. Wouldn't use her name on this, and we've changed her name on a blog post that we wrote about this. But basically what you'll see here on this slide is kind of three presentations of the same story. It's written verbally here, it's on a table in this area, and then it's on a graphical representation. And so we'll start with the graph. You know, any of the crosses represent in-clinic visits, any of the phone calls represent phone calls, and the different colors represent months. And so you can see we had a lot of visits over just a short number of months. And basically this is a 63-year-old female that came to our clinic after having not been on medications for a couple of years. And because of that, her blood sugar was highly elevated. And the reason she wasn't on medications is because she couldn't afford the doctor's visits to get the prescriptions. The prescriptions for diabetes with the older medications anyway, very affordable on the $4 and $5 list that you might get from Walmart or HEB. But she just wasn't able to pay the doctor in order to get the prescription. So because of that, her blood sugar was elevated. And so she found about our direct primary care membership program and joined. She lived about 55 miles away from us. But as you'll see in this story, you know, where you live is not as meaningful when you're talking about the type of access that you have to your doctor with Euphora Health. And so we had our first visit, and then pretty much you could see that almost every week or every other week we're communicating with each other. And I didn't really show you the text messages that we were trading, but there's text messages that are being traded as well. And so when you're able to communicate with your patients that much, you can really spend a lot of time educating them and walking them through iterations of, hey, let's change this, and now we've changed that, let's change the next thing in line, and kind of build on a foundation. And you're also able to kind of implement the types of changes that we try to focus on here, which is helping people to change the way that they live their life and really utilizing that as the foundation of any treatment program. Now that doesn't always jive with what the patient wants, and if the patient says, hey, I just either don't want to or can't implement lifestyle change, we can always fall back on a more traditional Western medicine approach, but our approach is to try to help people change their lifestyle. So when she came to us, her average blood sugar was in the 330s. This is A1C, which is a 3-month average of your blood sugar, and 12.9 is very high. So we spent most of our time in the beginning talking about insulin, talking about diet, refining her diet, changing the insulin dose. And you can look about halfway through, we actually stopped insulin because her blood sugar levels were so low by that point that we didn't need to utilize it. And by the time that we had kind of finished this kind of intensive period of 14 points of contact over 4 months, and you just can't see that number of contacts, you won't see that number of contacts in an insurance-based primary care typically, because you typically have to come into the office all the time and there's copay. So it's not affordable and it's not feasible for most people. But we had her controlled at an average blood sugar near the 130s at the end of all of this, and she wasn't even on insulin at that point. So, you know, here's the basis of what we do to help people with their lifestyle change, and that's to help guide them towards foods that can help them stay healthy, can help them stay feeling full or satiated, but at the same time, not result in elevating the number of sugar molecules in your bloodstream, which is the real problem in diabetes. And so this is a document that I'm able to send to any of our patients, and this document is really just a summary of a book by an endocrinologist named Richard Bernstein, who was a type 1 diabetic himself and an engineer before he was a type 1 diabetic. And he's really the one that has been pushing this path for diabetics for multiple decades. But when you understand the physiology, the pathophysiology of diabetes, eating in this fashion where we reduce the amount of carbohydrates, especially the simple carbohydrates that you're getting, really just makes sense. And so this is the foundation that we would use for most people. Certainly there are other lifestyle changes you could consider, like increasing exercise. Most Americans have limited free time. So if we have to focus on one thing or another, I suggest we focus on diet because it has such a powerful effect on your diabetes. If somebody has free time to do both things, great, let's do it. But even if they don't, you could implement simple changes that are evidence-based, like walking 30 minutes after you eat, so you're burning the sugar that ends up in your bloodstream. And then, on top of lifestyle change, there are pharmaceuticals that we could depend upon if we need to. And, even if we need to start pharmaceuticals at the beginning, we could peel those off over time as you improve your lifestyle and the need for those pharmaceuticals decreases. But what we try to do is we try to take our patients by the hand and help guide them towards the most cost-effective treatments. And you'll see some examples here. Many of the older trusted diabetes medications, especially something like metformin, you could get that $4 a month, $10 for 3 months off of some of these major pharmacy programs. But we'll go even further. We can help you get insulin at lower prices. This patient that I started the recording on, I helped her get old-fashioned N and R insulin from Walmart through their program. And they still sell those vials, 10 milliliter vials, for $25 a piece. That's all she could afford. But I could help her manage this in a better way, a safer way, and try to get that blood sugar down more quickly by utilizing insulin. She was able to afford this, and so that's what we used. They can also sell through Walmart. They sell N and R pens if you'd like to use a pen, and they just recently came out with a newer insulin on their Rely On brand, which is Novolog, and they sell both vials and pens for much lower price than you would get in a non-Rely On brand path. And so if you wanted to use a shorter acting but newer insulin, we could help you with that as well. And then, we go beyond that and help guide people towards like a continuous glucose monitor. What you're looking at now is a GoodRx website, which is a coupon-based website for mainly pharmaceuticals. But this is for the Freestyle Libre continuous glucose monitor, which is a button that you would put basically on the back of your tricep. It would stay there 2 weeks at a time. And you could use your cell phone as a wand to basically gather the data. And it tells you what your blood sugar is on a moment-by-moment basis. And what I found is just, for most people, having this data at hand, so they eat a plate of pasta and they see their blood sugar spike, gives them the data in the moment that they need to reiterate what I've already told them, which is we need to stay away from some of these foods and towards some of these foods over here. And just having that ability to kind of see what happens in real time really does help solidify the suggestions that we've made. And then beyond that, we try to help patients in any way we can, and that's also helping people to apply for patient assistance programs. This is an example of one for Sanofi, where if we needed to use a different kind of insulin, we could help somebody apply for a scholarship, basically, where they would get low cost or no cost meds for some specific period of time. We've got Apidra, Lantus, Toujeo insulins that would be available through this specific plan, and all of the medication companies out there have these types of plans available, and we're happy to help you kind of hold your hand and walk you through that process if you need it.